Okay, today is February 21st, 2021. This is my second vlog post, but for today, I was thinking about something that I kind of wanted to vlog about, and that just is, I often talk about like my experiences with medical doctors here in Canada and how it kind of compares to the US. Granted, I never had a serious injury like this in the US, but all the healthcare I received for, 39 years of my life, I don't really have too many complaints. I don't have any complaints really, except for maybe the last interaction I had with someone at an urgent care center, and I found out later he was actually a chiropractor, so I'm not sure why he was a chiropractor who became a nurse practitioner, and then he was working in a urgent care. And so I feel like the standards are kind of going down in the US, not because of the doctors, but because of they're allowing chiropractors with online degrees in nurse practitioner, or nurse practitioners who only have their degree online, to go ahead and like practice in the place of doctors. And that's why I think the standards are going down. Or you could have some subpar care in the US, and that's why, but not because of the medical doctors. I would say, not that I've traveled the whole world, but I feel like US doctors are the best in the world. And yeah, so it's interesting to me because like as the patients, and this is what I want to talk about in this vlog, we find out who people really are, like who the doctors really are, when that door closes, or your interactions. Like, how do you react to or how do you treat somebody who isn't bringing anything to you? As far as, I'm not a prestigious patient. I'm not gonna, I'm not someone famous that they're going to be like, oh, I treated this person or whatever. Like, it's just so interesting to me, that like we see who these physicians really are, like when push comes to shove, like, they're stressed out, and how they treat you as a patient. Like, I had this one doctor here, it was such a simple request. It was just for like a prescription refill, and actually it's not even for something, it's actually an over the counter medication. But if she filled out the prescription, then I could just have it through my insurance, so that's why I was there. So it's not like a big deal, but it was literally like a 60-second appointment. And like I said, it was not like even a drug really. It's something it's an over the counter medication, over the counter drug. So there wasn't like a big request. And I mean, she gets paid, for that 60-second really short appointment. And she just like was really like yelled at me, or like she was really harsh with me, and I'm like, gosh, what is wrong with. And it's interesting because how that lady is towards her patient that she thinks is a bother. She's going to treat her husband like that someday, or she's going to treat her kids like that, like in an abusive manner like that. It's like we see who people really are, for better or for worse. And yeah, the physicians who treat you really well, and even though you're not bringing anything as far as prestige to them, you're just another injured worker, or you're adding, or another sick person, another stressed out person. You're not bringing anything to them, and they still treat you well, which is it's definitely in the minority here in Canada. In the US, I never had a problem. I was treated with respect by their physicians, so I think that says a lot.